So does that mean a chiro can do what a physio can do and vice versa? Because you guys have been saying a lot of things that revolve around, and I'm thinking we are picking the wrong topic here. So that means in layman terms, you guys are struggling for patients. Darren, in your own opinion, what is that particular incident that will make you refer a patient to a physio? Give us one example.
Almost never.
So some time ago at the gym, I developed a shoulder pain from heavy lifting. And at that point, I decided to see a medical practitioner. And I had an issue because I was torn between the choices of seeing either a chiropractor or a physiotherapist. I know there are people who might be torn between these two choices and you don't know who to see. This is why this professional segment of Wet Waters is meant for you, which we term This or That, where we have professionals come on our panel to discuss concepts that are easily mistaken in society. We're bringing you this first episode of This or That. And today we're discussing chirotherapy, which is a word I coined from chiropractic and physiotherapy. So sit back and relax while we jump in. So we'll be looking at the differences, we'll be exploring the similarities between these two medical practices. And on board today on our panel, we have our chiropractor here, Mr. Darren, and also we have our physiotherapist here, Mr. Justin. So in a moment, we'll be jumping in. But before then, we would like you to introduce yourself. Just tell us about what you do, basically. Mr. Justin, please.
So I'm Justin. I'm a physiotherapist at Precise Rehab. So I've been working with this particular company for the last 2 years. And we mostly deal with a lot of sports injuries, patients who recover from surgery. We also deal with office workers who have daily aches from sitting too long or standing too long.
Interesting. Thank you for coming on board, man. Mr. Darren?
My name is Darren, and I'm a chiropractor in Connect Chiropractic. We deal with a lot of patients with general pain. So back pain, maybe slip disc, and anything like that. So yeah.
Okay, guys. Yeah, thank you very much for coming on board, man. Mr. Justin, let's say I had a wrong form at the gym while I was training. At some point, I needed medical attention, and I got to a clinic. There are two doors. One door by the left is the chiropractor's office, and the other by the right is the physiotherapist's office. Which of these doors do I knock on?
So it's up to the patient or the client. For me, what you want to be doing is you want to identify what is the wrong form first, either by watching some videos, or you can Google what is causing that pain. If it's more of a muscular pain or more of a bone issue, then you can come to the physiotherapy. If it's more of a spine or it's something dealing with the back itself, we can always refer to the chiropractor. It's not a clear line of how the therapy should become.
Because sometimes you wake up with a pain.
Yes.
Maybe a cramp.
Yep.
Because you were at the gym, or you just recovered from an accident and all of that, or an injury, a sports-related injury. But you are feeling a pain.
Yep.
But you don't know exactly whether it's your bone or your muscle, right?
Yep.
So in that kind of situation, what does that person do? Which of the doors does he knock on? The chiropractor's door or the physiotherapist?
Understood. So if, for by what you said from the gym, then you can come to the physiotherapy first, where we'll do assessment. Either it's a bone or it's a muscle issue, or is it something to do with the spine? If it's more of the spine, we can always pass to the chiropractors. But if it's more of a muscular or a bone issue, then we will deal with physiotherapy aspect. Yeah.
Interesting. As a chiropractor, what would you suggest a person in that kind of situation? Which of the doors would you advise him to knock on?
Okay. Usually, right, personal experience, personal belief, right? I think that a physiotherapist and a chiropractor can work really, really well with each other.
Okay.
So that's why you can see, a lot of chiropractic clinics that would hire physiotherapists in there as well. So I believe that if a chiropractor and a physiotherapist works concurrently together to try to fix a patient, the patient will have a very high chance in recovery. Yeah.
Interesting. But it doesn't answer my question because I know right now there might be someone out there who is feeling some sort of pain, right?
Yeah.
and this person might be torn between these choices, who
Alright.
to see, right?
Okay.
So what would you advise? This person is looking at this door. This
Right.
is a chiropractor's
Okay.
office,
Understand.
and on this other hand, this is a physiotherapist's office.
Okay.
Why is it that you have to choose this particular door?
Okay. I would say go for a chiropractor. Okay. I would say go for a chiropractor.
Yeah.
Okay. If you really have to choose one door, right? Go to a chiropractor.
What's your reasons for that?
Why? Because a lot of times we believe that the spine, whatever that goes wrong in the spine, would affect whatever we do throughout life. All right. If our spine is not moving well, if it's stiff, if it's out of place, maybe your left hip is higher than your right hip. Things like this. However you move, your movement, however you sit, however you walk, especially if you go to the gym even, right? Everything will not be balanced. Everything will try to compensate with each other.
Yeah, exactly.
So when these things try to compensate with each other, you'll find out that maybe one side of your muscle is weaker
Yeah.
compared to the other, or the other is more tighter, right? So when these things happens, you will feel pain, right? You will feel like, oh, my muscle is tight. I will feel pain. We have to think, why is that muscle tight? And a lot of times it's because of the spine itself. It's out of place already. It's not moving well. And if it's not moving well, from there, you will have a strained muscle or a tight muscle.
Interesting.
Yeah.
What is the reason why you would advise such a patient to knock on the door of the physiotherapist rather than the chiropractors?
Understood. Yeah. So for us, I agree with Darren. The spine does play a big role. But what we learn in school or after years of practice is that, yes, the spine does contribute certain tightness or certain imbalances, like how Darren mentioned, but it's not the only reason. It can just be, the bone itself being misaligned. So it doesn't have to deal with the spine itself.
Spine misalignment.
Correct.
Yeah.
So that's why, like I mentioned earlier, it would be better for a physiotherapist to check first, and it is a spine issue. Then we can refer over to the chiropractor. Yeah.
You agree?
Yeah, certain certain statements. Yeah.
Okay. How do you know a pain that is spine related?
Okay. In theory, a lot of pain will come from spinal issues. Let's say you were talking about your shoulder, right?
Yeah.
What pain do you have on your shoulder?
Okay. Let's say it's a door pain.
Alright.
I mean, currently I'm still having shoulder issues,
yeah.
right? Like we were talking about just now. So it's like a door pain and it feels heavy.
Oh, okay.
Yeah. So
Yeah.
how am I sure this particular pain on my left shoulder is not spine related?
All right. So a lot of times people with shoulder pain, right? They would the joint itself is a very susceptible joint to get injured. A lot of people get the shoulder injured because a lot of times it gets really unstable because the joint can move in a lot of directions. If your muscles, your shoulder muscles, we call it the rotator cuff muscles, is not strong enough to keep it in place, it will dislocate very easily. You will sprain your shoulder very easily. So we know that about the shoulder, okay? As a chiropractor, we will always want to go back to the spine because we believe that whatever that is wrong with the spine, it will affect however we move in daily life, okay? So, for example, a badminton player, right? A lot of badminton players will get shoulder pain, shoulder injuries and all that, right? So we want to look at how the biomechanics of it, okay? So a lot of times when badminton player, they smash the racket and all that, right? A lot of motion, if a normal person with a normal moving spine, they will want to twist their body to try to use the momentum of their whole body to smash the racket, right? But let's say for you have a very stiff spine. Your upper back doesn't move as much, okay? You subconsciously would want to use your shoulders more to try to smash the racket. So subconsciously, throughout, maybe it's not like a one-time thing. Maybe it's been years, decades already, right?
Okay.
It's been happening for that long, right? Then slowly, you will strain your shoulder. there will be one point in time, a breaking point, where your shoulder, you will hurt
injury
yourself.
and all of that.
Yeah. This is where I backtrack when I said like a chiropractor and a physiotherapist will be able to work really well together. Yes.
So technically, we cannot be sure of if it's a spine-related injury.
Yeah. So as much as we can fix spine itself, definitely you will need to rehab your shoulder because you hurt your shoulder already.
Exactly.
Right? Together with it, we'll be able to recover better, I think.
Okay. Do you agree with some of the things he has said?
Yes,
most
I
of
agree.
it?
I agree. So most of the things he said, it's similarities between what we learn in probably uni or as we are working, which is as you mentioned, the biomechanics, the shoulder muscles.
Yeah.
But there is one point that this is again coming into the difference of school of thought between the physiotherapist and the chiropractor. Is that it doesn't have to come from the spine, from a physiotherapist point of view. As Caleb may have experienced, it can literally just be the rotator cuff muscles being injured. It doesn't have to be
There is no way you can know this before you see any of these practitioners.
There is ways. That's why I mentioned in the introduction, you can always Google it or YouTube to identify these
But
hints.
To be very honest, I'm thinking, if I have a pain, is it possible to know whether it's spine related or not from Google?
There is.
It's possible.
It's possible.
Interesting. So we should be doing more research.
Yes.
Okay. So basically, when it comes to chiropractic, most times it's something that's related to spine adjustments and all of that.
Yeah.
Okay. And when it comes to physiotherapy, it's mostly about massage and then like recovery plans and stuff like that. And I'm sure a lot of our audience would like to know, how is your treatment method to that patient who knocked on your door? How is it different from his treatment method, basically? What makes it unique? Your own treatment method.
Yeah. Okay. So if you come to Precise Rehab or in fact any other physiotherapy centers, the first thing that we would get from you is your medical information and also probably your history of the sport or history of injury. So from there, we would slowly be able to piece the first part of the puzzle, which is how it happened. Then second, we will go into the identification of the muscle or the bone or the spine. That's how I mentioned earlier. So if it is a muscular issue, then we will go with the massage or the stretching. But if it's a bone issue, then we would not massage it because it may not give the most optimum rehab. Then we will go more into stabilizing or strengthening it as it helps to make it recover faster. And then if it is a spine issue, then we can do it from a physio point of view or we can pass on to the chiropractor.
How about you? What makes your practice different from a physio's treatment method?
What makes it different is literally that our ability to be able to influence the spine directly through adjustments, right? Let's say, you are having back pain. Maybe it's a slip disc, right? We need to know why a slip disc will happen, right? A lot of times, if a disc bulges out from the spine, it will press on the nerves and all that kind of stuff. Then you'll feel pain. Then your muscle will spasm out and all that kind of stuff. We are able to directly influence it in a way where if that spine is not moving, it presses on the disc itself, we'll be able to move it better. We'll be able to try to realign it back, right? In that way, the pressure will alleviate and you will feel a certain type of relief. I'm not going to say like it's 100% straight after an adjustment. It's definitely...
So your adjustment process, is it just massaging the spine to realign or...
Not massaging. We would
yours is massaging, right?
Yeah.
Massaging the muscle.
Correct.
Yeah.
Okay. Yours
so
is
we'll
what?
Trust the...
What do you mean by trust?
So...
Sorry, I know this is a medical term.
Literally just, your spine is here, then I'll just press it down.
Really?
Yeah.
Interesting.
So we'll just press and we try to realign it back.
What if you find out that particular pain is not spine related?
If it's a herniated disc...
I have this pain on my shoulder and I come to you.
So, all right.
And you find that it's not spine related.
Okay.
So what would you do?
Right. So in Connect Chiropractic, right, yes, we do adjustments. So when you come in, right, you talk about your shoulders having problems and all. We'll ask you questions as well. We'll try to find out how did you hurt your shoulder, okay? Maybe it's purely an injury on your shoulder, okay? We'll definitely check your spine as well. We'll check, we'll adjust what needs to be adjusted. If you still feel pain there, then we'll try to do rehab as well. So whatever we do, we add is just an extra, like the chiropractic adjustment will be there, and then we'll do rehab as well. So if
the rehab includes what?
So muscle. We'll try to press.
Muscle massage.
Yeah, we'll try to.
Okay, so this is where you guys share some similarity.
Correct.
Yeah, so it really depends on the chiropractor as well.
Okay.
Some chiropractors just don't touch muscles or anything. Some chiropractors, they would do these things as well.
But at that point, you find out that this is actually spine-related injury. Is that within your scope?
There is. So we have our own tests between physio and chiro. If it's something that the physio can't do, then we would refer over. But that is maybe 10% of the cases. So in the other 90%, it falls under something that we can assess and also treat.
So you also do thrusting of the spine?
Not
Whatever
trusting
that
per
means.
se, but we are mobilization, correct. So we are.
So what's the difference between thrusting and mobilizing?
So if maybe
You see, are you also a physiotherapist?
so maybe if your elbow is out of place,
Okay.
then when I thrust it means I'll do it quickly. So it's like a high,
Or like high intensity?
yeah,
Okay.
like a quick, right? Probably for them, they try to move it.
Yes, correct. So we have two things. One is a high velocity, somewhat similar to the thrusting, but we also have mobilizing the joint itself. So there is anterior posterior, which is up and down, and also lateral medial, which is left and right.
Okay.
So it's just depending on what is the assessment from the particular physiotherapist, and then what is his or her skill level. Then there are different ways to treat this particular issue. Yeah.
Okay, yes, because there was a time I called a clinic. Funny enough, here in Malaysia, it was a physio service, but they were asking me, do you want to see our advanced doctor or you want to see the entry level, something like that? So there are things like that.
Yes.
That will also affect how they treat you.
Okay, it does not affect how.
For example,
yes.
sorry
no
to
worries.
cut you short. So let's say you're an entry doctor, whatever you call it, right, as a physio, and there's another physio who is advanced. What will be the difference? They're going to use different methods or what?
Okay,
Because
so
I'm sure some of our audience might really want to know about this. Yeah.
So it's not a difference in skill, but it's a difference of the treatment methods. So the assessment would be generally the same no matter you're a new fresh grad or are you someone who practiced a few years like me, or someone who has practiced 10 years like the very experienced physios. The assessment remains the same, but there are certain treatment methods, for example, dry needling or manipulation, that the entry level is not experienced enough, or they haven't learned this particular method. Yes.
Because of course experience will breed more
Correct.
professionalism. Okay, thanks guys. So we're going back to those two imaginary doors. The chiro by the left and the physio by the right. Okay. And let's say at this point, this patient walks into one of these doors as a medical practitioner, and you can find out that for some reason he's a bit reluctant and thinks that, okay, he might want to see the other practitioner, okay? At this point, how do you handle that particular patient? What do you tell this patient? How would you handle? Would you say, oh, okay, you want to see the chiro? Okay, you can go. Or you say you want to see the physio? Oh, yeah, you can go. So how would you handle that?
All right. So from me, actually, I see a lot of these cases every
day. It happens, right?
It happens a lot.
Interesting.
Yes. So it comes down to two things. How confident are you as a practitioner? Also, the track record of my clients referring their friends. So that's the first thing, the mindset of the physio and also the client. And second is that letting them to see how does other clients or other patients in the clinic is experiencing their own treatment would change that mindset as well. So for example, say, like Caleb, you come with a shoulder pain, but if you see 3 other patients in the clinic that is dealing with their own shoulder pain, you would feel more confident, correct? And then you will see that, hey, this place is able to help me in
Yeah,
relation to my
fix
shoulder
this.
pain. Correct. Yeah. So that is how we would change the mindset.
Interesting. How would you undo that?
It's quite similar. I think it's very similar to just your whole demeanor when you talk to a patient, right?
Yeah.
So it really comes down to the way that you talk, the way that
You can convince them.
Not really convince them.
Not in a negative way, like deceiving them, but
Not
making them understand you are capable.
Yeah, show them what is wrong. How you explain the condition to them and show them what is wrong. So basically, maybe or they feel pain here, they can't move here. More objective findings, then show them with results. Basically, like a lot of times after treatment, you recheck again. You show them, hey, your shoulder, you can move better now, right? This muscle is not as painful anymore after the adjustment. You show them these things.
So it's like saying a trial will convince you,
Yeah.
not confuse you.
Yes.
Okay. I want to ask this question, which comes from most of the things you've said.
Yeah.
Does that mean a chiro can do the work of a physio and vice versa?
Okay, so
Because
yes.
you guys have been saying a lot of things that revolve around, and I'm thinking we are picking the wrong topic here. So, I mean, Wet Waters professional segment, this or that, is about highly mistaken concepts in society.
Yeah.
But from what we are having today, a chiropractor or a physiotherapist, who to see in the case of an injury or a pain, you guys seem to share a lot of similarities, very similar techniques and all of that. So does that mean a chiro can do what a physio can do and vice versa?
I would
Okay,
say
okay. You take first.
The difference is that we put a lot of emphasis on chiropractic adjustments, okay? There's a lot of different types of chiropractors out there. Some chiropractors, they really just focus on adjustments.
Okay.
Some chiropractors, they do some stuff that physios can do as well, right? So for me, I would say that I can do what a physio can do,
Interesting.
but probably just not as well,
As they can.
As they can.
Justin, how
Yeah.
about you? Can a physio do what a
yes.
chiro can do?
Like I said, 90% just now. So we assess almost a similar way. We treat almost similar ways as well. If you want to look at spinal
The
issues
treatment
or
method and
shoulder
stuff.
issues,
Yeah,
yes.
yeah.
But the main difference I would say is just how the progression of the client. So if we look at most of the patients, they just want to get rid of the pain. But physiotherapists not just treat the pain, but also we would strengthen or rehab them. Correct.
Yeah. Interesting. So there are people out there which I'm very sure, because I've met a lot of persons and I talked about these two different practices, and some persons generally think that when you hear the word chiropractic, it talks more about back pain.
Yeah.
And there are people who also believe that when you talk about physiotherapy, it's about probably post-surgical recovery or maybe sports injury. What is your take on that? Are these misconceptions?
So like the two things you brought up, which is the post-surgical and also people
Sports
who
injuries.
sports injuries. Yes. So these are things that we mostly see, but if you break down or look at physiotherapy as a whole, there's actually 5 different avenues or 5 different specialties. So what you said just now falls under one, which is MSK or musculoskeletal, to deal with the muscles. Then we have neuro or stroke, Parkinson, mostly old people disease.
Okay.
So it's combination of neuro and geriatric. So geriatric meaning old people.
Okay,
Yeah.
okay.
So neuro and geriatric. And then the 4th one will come into pediatrics, which is kids.
Okay.
Yeah. And then the 5th one is day to day. So if you say you sit too long, for example, we're sitting here for like 10 minutes already, I'm feeling a bit of back pain. So it can just be, muscular aches or postural related issues. So those are things that a physio can do as well. Yeah. So it's not just sport injuries. There's
Not
a
just-
lot of things else.
Cairo, how about a back injury? Is that basically what chiros do?
Not really. A lot of what we do actually, it's less of trying to reduce pain only.
Okay.
A lot of our treatments is very much focused on maintenance care actually.
Yes.
Right.
yes. Preventive care.
Yeah. So what we believe is literally, the spine, right, it houses your spinal cord. It's your whole nervous system, right? If there's something wrong with the spine, right, the nervous system would not be able to work as well. Once our own nervous system won't be able to work as well, whatever signals that it's giving out towards our body won't be as optimized anymore. So we deal so much more than just back pain, right? We deal with overall health. We deal with overall movement of the spine itself.
Interesting. So from what you guys have said here, I can say that if we were to go back to that hypothetical doors, those two hypothetical doors, it simply means that a patient who is torn between the choices of either a chiropractor or a physiotherapist, we can confidently say that if he walks into either of those doors, he has a chance of being a patient to either of these practitioners, right?
Yep.
So that means, in layman terms, you guys are struggling for patients. Okay, if you guys are struggling for one patient, is there any bone of contention between a chiropractor and a physiotherapy? Do you guys look at yourselves like some sort of practitioners in some sort of, tussle for clients?
So like what Darren brought up earlier, there is always, or I would say in Malaysia itself, there's like 60% of chiros or physio centers that have both. So we work really well together. It's just that issues that we treat will not be similar.
Okay.
Like how I mentioned earlier, if it's more of a neuro, if it's more of a geriatric issue, then maybe it's better or safer to be under a physiotherapist's care. But if it's more of a muscular or a spine, then it's something that a chiro can do. Yeah.
I don't think there's any disagreements. I think
Any bone of contention between you guys?
not really. I think it's just we are all working towards the same path. We all believe that a patient should be able to, the
Darren,
posture.
sorry, let me cut you short, okay?
Yeah.
Let's be more realistic.
Okay.
Okay?
Right.
Let's forget about our hypothetical doors.
Yes.
Let's be more realistic. I'm a patient.
Yeah.
Your office is next door to his,
Yeah.
right?
Yeah.
I come with a shoulder pain, and I think you can treat my shoulder pain.
Yeah.
And I think somehow you can fix my shoulder pain.
Yeah.
Now, in that scenario,
Yeah.
you guys are capable of treating me.
Yes.
Is that not a way you guys can have some sort of beef? Like,
There is more than enough people currently in Malaysia, so there's no.
you just wait
there's
for
no-
the next client.
I think I don't have a problem with how physiotherapists approach pain, but I think it's more of a problem when you go to see a medical doctor and maybe they would just prescribe you painkillers. They prescribe you medicine. That's what I feel like.
It's wrong.
Not really wrong, but it wouldn't
Improper.
really work
Yeah.
as well because you're just kind of like plastering over the pain to a point where if it
Okay,
gets
yeah.
really chronic, then
Yeah.
it's very hard for us to treat you.
To treat. Okay.
Yeah.
Okay.
So the
So
whole
you wouldn't have an issue with a physio.
not really.
Interesting. But can this be said for most physios and chiros out there?
I have chiro friends. I have osteopath, which is something that's related to two of us
chiros.
actually.
Yeah, okay.
So we are all friends, and we do refer it to each other. So yeah, there's no bone of contention.
What is the scenario you would refer a patient to a chiro?
One scenario is someone who wants maintenance. Say
Okay.
they have spinal issues. So a very good example I would use is scoliosis.
Okay.
Yeah. So this is something that
Like scoliosis, the bend
the bend of the
spine.
S curve, correct. So this one you need rehab or
Yeah.
exercises, yes.
Rather
but you
than corrective,
would
yeah.
like or sometimes need
Yeah.
that adjustment from the chiro. So this
Yeah.
is a very common case that we would share both.
Okay.
Yeah.
Darren, in your own opinion, what is that particular incident that will make you refer a patient to a physio? Give us one example.
Almost never.
now we're getting it, right?
you want a conflict, right? almost never,
because from what you guys are saying,
Yeah.
I'm enjoying this, and I hope our audience out there are enjoying this, because it's really a huge learning curve.
Yeah.
I never really knew that you guys have very similar,
Yeah.
practices and all of that, and treatment methods. But it is why I asked that question.
Yeah.
So there would never be, almost never.
As far as I'm practicing now, I've never referred to a physiotherapist.
But it's not like you're being selfish about it, but it's just that you feel
because
it is something that most of these issues are things that a chiro can handle.
Yeah, in a sense where after I adjust the spine, I'm trained to be able to release certain tight muscles as well. I go to the gym, so I know certain ways to strengthen your muscles as well.
Yeah.
Try to get balance, try to have a better form and all that as well. So I feel like I'm able to do certain parts of what a physio can do. But I'm not going to say that I can do it better, but I can do it as well.
Okay.
Yeah.
I think that makes the difference, the efficiency in the particular. Okay, all right. We'll be wrapping up pretty soon. Let's talk about the future. Okay.
Yeah.
In your opinion, do you think the advancement of technology, we have AIs, we have robots, right? Do you think at some point these different advancements in technology could affect your practice as a chiro and as a physio?
No, never.
Never. There will never be a time robots can do better.
I don't think so. Whatever we do, it requires a certain skill.
Yeah.
And I don't think you can make robots for that. In our line of work, it needs a very human touch to it.
Exactly.
Right?
Like the sensual part of the job. Yeah.
It needs a empathy part of it.
Yes,
If it's just a very robotic procedure,
Is there a possibility robots could be trained?
To have empathy,
That's a great question.
I don't think so. Do you think so?
I mean, with the advancement of AIs these days, we have AIs that get really trained and they're doing a lot of crazy things and all of that. So anyway, how about you, Justin?
So I would say I agree with Darren. There is no replacement, but we will work concurrent with them. It's actually happening already. So
really?
Yes. So in advanced countries, say the US, the UK, we already mix robots or AI to help us to carry or transfer patients from the bed to say a wheelchair or to walking.
Interesting.
Yep. And then the second also is these AIs are able to help people to say who have spinal cord injuries or say they were born with it, correct, or deteriorated. Yes. So these robots help what a physiotherapist used to do, and now we can more focus on the rehab
treatment.
Correct. Instead of
the rehab,
the transfer
diagnosis, and all of that.
No, diagnosis will never be replaced.
Oh, really?
Yes, because it's a mode of experience. That's the first thing. And second is also the empathy, like how Darren said. Because if you look at AI, it's step 1 to 10, so to say. But for a physio or a human, we would not go 1 to 10. We will go 1, 3, 5, and then come back to 2 again. Yeah.
Gradually.
So it needs that adaptability and also that human touch to
and you
make
need that
it
feedback.
correct.
Every time, like when you were treating me, you touch my shoulder and you're like, how do you feel and all of that.
Correct.
Interesting. Okay, the last question we have for today before we give it a wrap here on This or That, the professional segment of Wet Waters. What advice do you have for someone having pain, maybe from weight training at the gym, or maybe from cycling and stuff like this, and this pain becomes like more frequent, and yet this person doesn't have a need to see a medical practitioner? What advice do you have? Because I remember when I came to your clinic, we had some very good conversation about, how these things, when I told you how active I am, and yet I feel these pains sometimes, and I asked you, is it not better we can just chill and don't do anything, don't be active, no need for exercise, so you don't have to feel pains and all of that.
Correct.
So please tell us exactly what is your advice for such people.
Yes, I want to sit up straighter because this is something I see almost daily. Like how can I say? It's really, why would you want to deal with any pain in general? It's so bothering. It affects your every movement, so you need to overcome it. Sometimes being active, like how you mentioned, is not enough. You need to know what is the right way, and you need to know what's the right dosage as well. if you want to be active. So say if I use yourself as experience, you have done a lot of shoulder exercises, you go to the gym, you do boxing, things like that. But sometimes doing too much or too little would make it painful or make it bad instead of helping you to be stronger.
Okay.
Yeah.
I was asking Khalif just now. I said, who are you going to see if you have a back pain? He said, I'm going to suck it up. So what advice do you have for such people?
I think the mere fact that you're in pain already means it's your body's way of telling you that, dude, something is messed up. You need to fix this already. A lot of times we have problems in our bodies that might not reflect in pain. And a lot of times when pain comes up, it's really that final straw for your body to show you that, hey, dude,
something is wrong.
Something is wrong, right? So the mere fact that you're having pain means you need to find a way to treat it, right? And whenever patients come in as well, they will tell me, I will ask them, yo, how are you feeling today? And they always tell me like this thing where it's always very funny to me. They will say, yeah, I'm just having normal pain. There's no pain that is normal. If there's pain, there's problem.
Yeah.
Normal is no pain, right? So yeah, if you have pain, then you should definitely get it checked before it gets worse.
So guys, like we've heard from the professionals, if you are having an issue concerning, pain, whatever it is, from an accident or from heavy lifting or exercise and all of that, you know who to contact. This is Mr. Darren, our chiro here, and then we have Justin, our physio. Thanks for having you guys on board today. Thanks a lot. And like I said before, this is This or That, a professional segment of Wet Waters, where we talk about highly misconstrued concepts in society. We will always have professionals like this, and I will urge you guys to click this subscribe button. You will get notified every time we have new videos in our subsequent episodes. On the other hand, the details of our professionals here will be relayed down on your screen, so you can contact them. If you're here in Malaysia and you need their services as a chiro or as a physio, you can always contact them. And if you are out of Malaysia, you can also give them a call, as their details will be relayed down the screen. Lastly, you can follow us across all platforms on social media, Wet Waters. Like and share this video. And till I see you guys again, stay blessed.